Hello, I am Bernadette Vasquez. I am the co-chair of the Human Rights Coalition of the Central Valley. We begin our gathering today with the acknowledgement that we are standing on the land of the Yokot Mono Native people. We recognize them as the past, present, and future caretakers of this land. We also honor the presence of our Indigenous ancestors who are with us as we claim and as we acknowledge and we bring awareness to our human rights given to us by our birth on this land. So thank you. Thank you all for being with us today. Dr. Kapoor, I hand it over to you.
Thank you, Bernadette. I would like to join my colleague Bernadette in greeting all of you. Today is Human Rights Day. We will talk about it a little later, but I want to actually bring our special guest who is going to make special remarks on behalf of the university. This is a person whom I have known for many, many years. She's young, let me tell you, actually. And she's one of those persons on the campus whom I respect very dearly. She holds many responsible jobs. I have known her in many capacities, but she's a great supporter of the work that I do on this campus. So that gives me a little bit more moral and spiritual strength to continue what I am doing. She is a person who runs the administration of the university. She is the vice president for administration on our campus at Fresno State. And she has been greatly helpful to me, particularly in many projects and activities that I organize on this campus. Let us welcome Debbie Adishian-Astone, Vice President at Fresno State Campus. Welcome, Debbie.
Thank you so much,
Your floor now. Thank you.
Thank you so much, Dr. Kapoor, for that kind introduction. And it has been my honor to work with Dr. Kapoor on many important initiatives and projects, most importantly, our beautiful Peace Garden at Fresno State, which would not be made possible without Dr. Kapoor's leadership and passion for all that he does in promoting nonviolence and peace. And he has been a mentor, and I have learned so much from him over the years, and it's just an honor to be able to work alongside with him on these many important areas of focus for our university and our community. So I want to welcome everyone to the Human Rights Day today, and on behalf of Fresno State and President Castro and Provost Jimenez Sandoval, just want to say thank you for your participation today and for the important work that the Human Rights Coalition of the Central Valley continues to move forward. And it's very important that this issue is always at the forefront of our daily lives, especially now more than ever. And I also want to thank our panelists. What a premier group we have here. We will be learning from, especially at this very critical time in our nation's history, and as we work together as a community in navigating this pandemic and the impacts that it's had on our community. So I want to thank our panelists for being here today, and to Dr. Kapoor for his continued leadership and passion of this important area of focus for all of us. So thank you, Dr. Kapoor.
Well, thank you very much, Debbie, for your very gracious remarks. We really appreciate your being with us on this very important day. I know you have plenty of things going on that you have to take care on this campus, and particularly during these very stressful and uncertain times. You are all going through and experiencing something I have not experienced in my lifetime. I'm in my late 80s. This is the first time that actually I'm going through where I'm confined at home teaching from home, which is a very different experience for me altogether like that. And I know you have tons of things to take care. We really appreciate your being with us and able to give us this beautiful message on behalf of the president and incoming president. We really appreciate that.
Well,
God bless you for all what you do for all of us. Thank you very much once again.
Thank you, Dr. Kapoor. And
Yes.
I am going to listen in as well. We've been working very closely with our colleagues at the Fresno County Department of Public Health at the very beginning of the onset of this pandemic, and they have just been tremendous partners in helping the university navigate and being part of our plans for both fall and for spring. So if it's okay, I'm going to listen in because as Dr. Castro says, there's been no playbook for all of this. And so we're all learning together and supporting each other.
Thank you. Let me say a few words about why we are here today and what we are trying to actually accomplish. Today is a Human Rights Day being observed globally, International Human Rights Day. 72 years ago, on December 10, 1948, Universal Declaration of Human Rights document was adopted under the leadership of Eleanor Roosevelt. The United States has made a tremendous contribution to the development of human rights. The document that is available to all of you, we will be glad to help in case you need a copy of that. I think everybody should read it. There are many other documents that have come after that, but this is the first document, Universal Declaration of Human Rights, December 10, 1948, which lists 30 articles, which I really follow very faithfully and very religiously, trying my best in my own life like that over there. And talking about the human rights document, I just would like to say that the result after the World War II, this document was adopted. And what we had seen during World War II, and particularly what happened during Holocaust. So there was an awakening and awareness to do something. So United Nations, that was born earlier, I took this task actually and asked Eleanor Roosevelt to help us to develop this document like that over there. So the document was created by United Nations under the leadership of Eleanor Roosevelt. It sent a very powerful signal to the world governments to be accountable and respectful of human rights and the basic freedoms of their citizens. It also made the citizens responsible for holding their governments accountable. The document is aspirational in its vision of a peaceful and just world order. And that's what has inspired us to bring Human Rights Coalition of Central Valley into existence like that. Human Rights Coalition of Central Valley is a collective of faith leaders, scholars, and community activists and organizers who are committed to educating the Greater Valley community about human rights. We are a nonprofit, nonpartisan, grassroots organization which promotes networking, collective efforts, and coalition building around issues, policies, and practices affecting human rights. Our major role at present is creating awareness about human rights. We do not do legal advocacy, but we do social advocacy. We are not equipped to do the legal advocacy work, which we actually rely and depend upon other organizations like ACLU, but we do actually advocate what we call social advocacy like that over there. So we would like all the people to know more about the Human Rights Coalition of Central Valley and become a member of that. We will be glad to provide you more information. Now, other reason actually that we are here today, we are dedicating Human Rights Day today to United Nations 75th anniversary. Now, United Nations is a very big organization. I'm pretty sure all of us know. So 75th anniversary, we are observing and we are dedicating today's Human Rights Day to United Nations 75th anniversary. As you know that this year, 2020, is the year of 75th anniversary of United Nations. On October 24th, 1945, the Charter of United Nations was adopted by 51 countries after World War II. And you know where it happened? It was in San Francisco. And I have visited that building where they adopted the Charter of the United Nations like that. United Nations is truly a universal and global organization. It is an intergovernmental organization to address issues and problems that transcend national boundaries such as COVID-19, climate change, hunger, poverty, etc. United Nations provides a global perspective that benefits all nations. Its purpose is The purpose of United Nations is to maintain international peace and security and prevent wars, to develop friendly relations among nations and promote human rights, to achieve international cooperation and harmony through various developmental and peace-building projects. It is a very big peace organization. The theme for the 75th anniversary of the United Nations is the future we want, the United Nations we need, reaffirming our collective commitment to multilateralism. Now, as I mentioned, that it is an organization that's trying to promote cooperation among various organizations around the issues that affect all of us. And now, particularly, we are facing an issue that affects all of us globally as well as in our own community. COVID-19 is a stark reminder of the need for cooperation across the globe, across the borders. The same is true for our own community of Fresno, where various sectors and segments have come together to address this gigantic problem that we are facing today. How well we are prepared, how well we will handle all these pressures and challenges presented to us by COVID-19 depends on how we cooperate and coordinate. And that's what we want to hear today from our experts. So I am now going to hand over to our moderator, Veva. I like to call her Viva. Viva Velva. Viva Veva.
Viva Veva is great. Thank you so
Thank you.
much.
Veva, now it is in your hands. So you are there to take care of the rest of it from here onwards.
I'll take
And we
it
are
from
looking
here.
forward to your leadership. Thank you very much for being with us.
Thank you so much. So I want to offer good evening and welcome to everybody who's joining. We are here at the Health Crisis and Human Rights event. I'm your moderator, as Dr. Kapoor mentioned. My name is Genova Islas. I am the executive director of Cultiva la Salud, which means cultivate health. We're a public health advocacy organization. And I'm also a Fresno Unified School Board member, proudly representing the McLean region. It was my absolute delight and honor to be invited to be a moderator this evening. I want to reemphasize where Dr. Kapoor left off, that tonight is the 75th anniversary of Human Rights Day. And the theme of this year's Human Rights Day is to stand up for human rights. Under the UN Human Rights Generic Call to Action, we aim to engage the general public and partners and the UN family to bolster transformative, practical, and inspirational examples that can contribute to recovering better and fostering more resilient and just societies. Human rights must be centered on what we do in a post-COVID world. And that means that we continue to work on ending discrimination of any kind, addressing inequities, encouraging participation and solidarity, and promoting sustainable development. And I think that really underscores why I'm so passionate about it. As a child born and raised here in the Central Valley as farm workers, I'm acutely aware of the inequities that we are under in this region and the importance of working collaboratively together in order to work past those inequities. So I want to just give a quick instructions to the audience, let you know that as your moderator, I'm going to try to keep us on time. I'm going to try to also be an instigator in asking questions of our panelists. I want to make sure that you're comfortable. So I hope that you are seated well, that you're relaxed, that you're engaged in listening to this conversation. And also, I hope that you have technology at your disposal that will allow you easily to engage. One of the things that we do want you to do is to utilize the chat feature as a way to ask questions. So this is probably one of the only times we don't get to tell you when you can ask a question. Feel free as you're listening to the speakers to ask questions. And we will get to as many questions as we can after we hear from our panelists, right? So I will introduce each speaker. They will have about 8 minutes to give their remarks. And at the conclusion of each speaker, at the conclusion of all the speakers, I should say, we'll dive into your questions. So again, just thank you so much for being here. I will move now to introduce our first speaker. It gives me great honor to do this. Our first speaker is Dr. Vohra, and some of you may know him as a emergency physician. He also happens to be a medical toxicologist. And it reminds me of a very cheesy joke I once heard where someone said that they once told a toxicology joke and no one was affected. It took me a while to get the humor in that, but I'm sure some of you will get that. What is really amazing about Dr. Vohra is that some of you may not know this, but he was appointed to be the interim health officer for Fresno County in January of this year, just weeks before the outbreak of COVID-19. He's still with us, thankfully and gratefully. And what a pleasure it is to have him, because as you look at his bio, he has gone to Baylor College of Medicine in Houston. He's completed his bachelor degree in training from UT Southwestern Medical Center. He has worked at UC San Diego. So he's a very accomplished physician, and we're just very, very lucky to have him with us today. And he has really been leading us at the forefront in response to the pandemic here in the Central Valley. So with that, Dr. Vohra, I'd like to invite you to join and make your remarks.
Thank you so much, Veva, and thank you to Dr. Kapoor, to all of my fellow panelists and the hosts that invited me to do this talk. I get asked to do a lot of things, and I usually deliberate. And when I got this invitation from Dr. Kapoor, I immediately said yes. No deliberating at all. So I was so honored to speak about this topic to this group, and I think it's so important to have this discussion and to celebrate what we're celebrating today. I'm going to keep my comments hopefully short and not too much about COVID, although you'll see COVID will sneak in as it does into every conversation I have these days. But I just wanted to start out and just share something probably a little personal that I don't get to share when I'm doing my media updates, which is that, you know, I really love stories. I love telling stories. I love listening to them. I think that, you know, it's a real thrill to just be a listener in a fantastic story. And even more thrilling to be a participant, and I feel like all of us are participating in a thrilling adventure right now with this pandemic. When we talk about stories, you know, we usually talk about heroes, and heroes are valuable. The hero stories are everywhere. Everyone loves Conan and Superman and Wonder Woman and all the Marvel heroes. It gives us a vicarious joy and pride to see someone who's almost superhuman, whether they're playing a sport or giving a lecture or playing a musical instrument as delicately as a physician performing surgery. But there's another kind of story that is not as appreciated. And that's the story when a group of people, usually ordinary people, come together and then they achieve something amazing. And that kind of story requires that people set aside their differences, perhaps, and instead seek out common goals. And when they achieve something that would have been impossible by any of them alone, that really inspires me even more than the story of a single hero. In a nutshell, I just love it when a team makes a plan and when the plan comes together. And as you can see from behind me, I'm a planner. You know, I have lots of to-do lists all over. I try to get to as many as I can in my role here in public health. That's really what we're trying to do, is to treat the whole county as our patient and really plan all the different ways that we can keep that patient as healthy as possible. I'm so glad that we're celebrating the formation of the United Nations. You know, I think there's no finer example of a group achievement than the UN Charter, a document that was crafted in the wake of the horrors of World War II. But it represents the pinnacle of exactly the kind of achievement that I'm talking about. I don't know exactly who wrote that charter. I suspect it was a diverse group that was led by Eleanor Roosevelt. And I suspect that they were respectful, but also argumentative. And I know for certain that they were also all refugees, refugees from history, as we all are, resolute in facing the future of our human species. And they had to face that future at a moment when the human species armed itself with an atom bomb and tons of other weapons of mass destruction. But they didn't give up the hope that they could and should and must get along with each other and show the way forward through collaboration and teamwork. So I just want to reflect on what a beautiful story that is, because I feel like it has many lessons to teach us today. We're all refugees too. We're taking refuge in our different ways from this surreal dimension. You know, I like to joke that we've all entered a planet called Planet Zumanji because we're doing everything over Zoom. Many people don't have that luxury, as you know. They have to put their lives on the line, whether they're essential workers or emergency workers or people that are tasked with keeping the public safe. But most of us do have that luxury, and we can take refuge, as it were. And we just need to respect that we're all in this together. We're crafting a common destiny, and we have to act like it. And I feel like we all need to really hold each other responsible to be advocates and members of a single human community. In terms of where we are with the coronavirus, you know, it's hard to beat around the bush when things are so serious, because we're experiencing the worst surge of this pandemic right now. You hear it, you see it in the headlines, you see it in the announcements that we make at the health department, that our hospitals are severely impacted. Ivonne is going to give us a personal snapshot of what that feels like from her perspective. And that really explains the stay-at-home order that we've crafted as a state and as a region for the Central Valley. It will affect the next few weeks, and hopefully will just provide a great excuse to stay home and catch up on your reading, including the beautiful human rights charter that Dr. Kapoor mentioned. But I know that we do have to adjust and get through this very hard period. And I'm hopeful that we will get through it. I think that if the county of Fresno and the surrounding counties were a patient, then the vital signs of the county are not very healthy right now. And we're working very quickly. We have to work quickly and creatively to get things back on track. But we have a lot of resources that we're bringing to bear during this crisis. We're hoping to get vaccines starting to be distributed. And over the next few weeks and months, we can get more and more people protected with this breakthrough that has been developed in the realm of vaccination. And we hope that we can survive long enough to really look back on this and say, this is yet another chapter of people coming together, setting aside differences, making a common plan, and building something that's even better and more resilient in our society. So I always try to remind people that this is a war against viruses. This is not about humans versus humans. This is about DNA versus RNA molecules. And the DNA has to win. We have to conquer COVID. We don't have a choice, and we need to keep our focus on exactly what we need to do to make sure that we get there as soon as possible. My strategy, as many of you are aware, is to just really lean into communicating the science. I feel like when we arm people with science and literacy, that is really the best way that we can deal with any epidemic. Behind me, you see my to-do list for 2021, and it's really everything beyond COVID. Obviously, we're not going to take our focus off of COVID, but we understand that there's many other epidemics and health needs that we do need to address. Things like chronic diseases and access to care, substance use disorders, maternal health, child health, and elder care, homelessness and social determinants of health, climate change and environmental health, nutrition and food issues, sexually transmitted diseases, and yes, poisoning prevention as well. So we have a lot to do. The common secret to all of this, in my opinion, is that the epidemic that underlies all other epidemics is illiteracy. And that's why I celebrate all of us coming together, especially under the auspices of Fresno State, to really fight that common epidemic of illiteracy and make us all a more resilient society by being a better educated society. So thank you so much for allowing me to take this time. Let me leave you with work that we need to do together. Like I said, I'm really into to-do lists. So I'll give you something to do this week, this month, this next year, and this next decade. This week, stay home. Just do it. Dr. Vohra said so, doctor's orders. Go ahead and stay home. This month, stay safe. If you do need to step out, wear your mask. You see my mask on me at all times, and do everything else that you know is good common sense at this point to keep yourself and your relatives and your friends and neighbors safe, to stay safe. In the next year, stay kind. This is a marathon, not a sprint. And one of the first things that we lose whenever we get burned out is our capacity for kindness, which all children have. It's an innate capacity, and we need to find the well of resilience that allows us to stay kind month after month and year after year. And I think that year 2021 is a great way to really tap into the personal resources that we can bring so that we can all stay kind and become kinder. And for the next decade, stay vigilant. It's going to be a new decade. It's going to be a very hard challenge to address all of the problems I listed and many more that I didn't even get to list. But the only way that we can all do it is if we do it together, working as a team and staying vigilant. Thank you so much. I really appreciate the chance to talk to all of you. And I'm really looking forward to hearing from my fellow panelists. Thank you.
Thank you so much, Dr. Vohra. That was wonderful. I appreciated all of the next steps to take. But I think what I'm really landing on is your emphasis about we can get through hard things together, right? Like if we do it together. Our people and our history prove that. So this is one of those times where we do need to band together to get through it. Our next speaker is someone who I have the honor of knowing for some time. One of the important sentences in her bio is underscoring how passionate she is about serving community here. And I've certainly been witness to that. Ivonne de Torosian is the Vice President for Community Health and Wellbeing at St. Agnes Medical Center. And Ivonne is responsible for assessing, defining, and developing strategies to improve health, prevent disease, and reduce health disparities through addressing social, behavioral, environmental, economic, and medical influencers of health. Ivonne is responsible for developing effective hospital community partnerships which are necessary to build healthier communities and promote a culture of health. So let's welcome Ivonne. Thank you so much.
Thanks, Veva. So my presentation style is a little bit differently than Dr. Vohra. Thank you, Dr. Vohra. First of all, I do want to say how truly grateful I am to be part of this panel and part of this conversation. I think it, it underscores what Dr. Vohra just mentioned, which is we're all in this together, and we're all working together to address this health crisis. I did develop a presentation only because I'm more visual than auditory learner. So I do want to share my screen with you, and give me just a second while I do that, because I did produce this for you. And let me see if that is working. I'm so sorry.
You're good.
Okay, good. So one of the things that, when we were addressing health is a human right during this crisis, I really do want to underscore what some of the things that we're doing as a hospital and what we're seeing. And so, hold on just a second. Let me. So I just want to introduce our what we stand for here at St. Agnes and Trinity Health. And our mission and our core values really are what guide us and guide our work and guides everything that I do within community health and well-being. We are a Catholic organization, and as a Catholic organization, our tradition is that we're looking out for the common good. It highlights that all of the positions that we take, we know that we need to work with all of our elected officials, all of our healthcare leaders, and public servants to do the good for all. So we do advocate for different processes and changes. This is part of our community health and well-being mantra, is that we're looking out for clinical interventions, community investments, and policy, environmental and system changes. So we do invest in our communities. We work to really deliver quality health care, and then we're also looking at social influencers of health. We have decided not to call them determinants of health because we do believe that we can change the trajectory of a lot of the work that we're doing, and really it doesn't determine our end game. So right before the elections, we launched a campaign that was called Care for the Common Good. And we had 4 different focus: access to care, affordability, public health, and healthy communities. And so I just wanted to go through some of this with you as we look at how we addressed all of these. So in terms of access to health care, we know that we are living in a community that is medically underserved. So when we say that we're living in a health crisis right now with this pandemic, COVID-19 really did highlight a lot of the challenges that we see within our community. And so what we see inside of our hospitals is a reflection of what's happening in our communities. But keep in mind that some people have been living in the health crisis much longer because they don't have access to health care. They live in communities where their community clinic is maybe 25 miles away. Maybe they're homebound, and so they cannot get to their medical provider. Maybe they don't have a medical provider, so they're coming into the emergency departments for treatment, for testing, for information. That is everything that we have seen with COVID-19. But truly, this is some things that people live with every single day. And so some of the things that we have done in terms of making sure that we are increasing access to healthcare because we know that we are medically underserved is that we've been expanding our residency clinics. We've been supporting our universities and our city colleges with internship opportunities. We've been making sure that we get information out to different communities so that they have what they need in terms of knowing how to address their health care. Some of the things that we want to continue to do para-COVID, I don't believe that we will ever get rid of COVID, So in our para-COVID world, we need to continue to work closely with public health and other hospital leaders and clinics and our community-based organizations to promote health in terms of making sure that everybody has that access. I want to put in a support for community health workers. They're the ones who build trust in their communities. They're able to dispel myths. They're able to calm fears. They're able to make sure that people understand why it's important for us to be able to connect folks to different resources in order for them to be healthier and really thrive in their communities. So then we also look at affordability. One of the reasons why we launched the Care for Common Good campaign was because we know that access to affordable health care is key for everybody to be able to access it. I'll tell you a little story about myself. Before I came to work for St. Agnes, I was unemployed by choice for 3 months. It was pretty scary. I had nothing to fall back on. And I started looking for health insurance because when I left my job, I had no health insurance. And for 3 months, I was very nervous that somebody in my family was going to get hurt. Because I went to Covered California and I looked at all the prices and I looked at all of the options that are there for people. And all I can think of was, how do people afford health insurance without a job? So it's paramount that we're able to provide affordable health insurance. We need to be able to vote policymakers in, talk to policymakers so that they understand the impact that their decisions on healthcare have on our community and on our families. Every change that they make has a change on how we're able to access it. So there are changes when they make different program concerns with Medicaid and drug pricing. All of that affects our families personally. We need to continue to advocate for integration of behavioral health into primary care. We need to be able to continue to advocate for innovative ways of reaching other folks outside of our four walls and outside of our clinics. One of the examples with COVID is telehealth, which has been really great, except if you don't have the opportunity and the capacity to have telehealth. What we know is that there's a digital divide. There's a digital divide in education, while there's a digital divide in healthcare as well. Everybody assumes that everyone has a phone. That's probably true, probably not, but a phone is not the same as a computer or an iPad, and it doesn't always work if you don't have internet and the ability to connect to your doctors. So things to think about as we continue to move through this crisis and beyond. We're working really hard, hospitals and clinics are working really hard to look at how to redesign the delivery of care and how to restructure our payment models so that it does become more affordable. So then let's move into the realm of public health. What does hospitals have to do with public health? Absolutely everything. Because if you look at this slide, 20% of our sickness can be taken care of in the clinic. The other 80% is taken care of outside of the clinic. But if you look at the way that we have traditionally funded health, 95% goes to clinical, so we're sick care, not health care. And then there's the 5% that we invest in our communities. Really what we want to do is we want to be able to adequately fund public health so that in the future, when we have future crises and other pandemics, that we're able to address it very quickly, that we take what we've learned with this pandemic and apply it to others in the future. One of the things that we also want to acknowledge and really put a finger on is that racism is a public health crisis. If we've seen so many deaths with COVID-19, we have seen just as many deaths with racism. We really do need to invest more in making our neighborhoods of color have the resources available to them. We need to be able to address all of our populations when they come into our clinics and when we serve them outside of our clinics. It's equitable care, not equal care, and every population has a different way of being taken care of. And we also want to make sure that we recognize in healthcare that there often is implicit bias that we must address. We're doing our part. We're talking about diversity and inclusion at St. Agnes, and I hope that other healthcare centers and healthcare hospitals are doing the same thing, because it's important if we want to see a healthier community.
Ivonne, we've reached time if you want to wrap up remarks.
I'll wrap up very quickly. So our healthy communities, we need to look at social influencers of health, make sure that we're investing, make sure that we're connecting our patients, our clients, our constituents to everything that we have in our communities, and build up those resources. So just finally, wear your masks, wash your hands, stay socially distanced, stay informed, advocate for change. Thank you.
It's so hard to interrupt you because I loved everything you were saying, Ivonne. Thank you so much for being bold and addressing some of the uncomfortable things that are happening in our society as well, but they're uncomfortable things that we have to get comfortable with in order to change. I want to move us to our final speaker, and I want to say that I have not known, only recently met Dr. Seabert, and I already love her because she is so down to earth. When I asked her about her bio, she was like, oh, don't worry about reading my bio. It's, no big deal to me. But your bio is very impressive, and you are a big deal because you're the Dean of the College in Human Services where I graduated from at Fresno State. So there's a very special place in my heart for the College of Health and Human Services. Dr. Seabert earned her PhD in health behavior from the University of Florida. And prior to coming to Fresno State, she was the Dean and Professor at the Usha Kundu College of Health at the University of West Florida. She is also Professor Emeritus from Ball State University, where she served as Associate Dean and was Professor of Health Education. Thank you so much for being here, Dr. Seabert.
Thank you so much. I really appreciate your kind welcome, and I'm so grateful to be able to serve with such a distinguished panel. I'm going to reinforce some of the things that they said, and as well as bring some new thoughts to the table. I also want to thank the Human Rights Coalition of the Central Valley and our sponsors, and especially Dr. Kapoor for making today possible. This is really a neat opportunity, and I will say it is my first opportunity to celebrate human rights in a formal fashion, and the first time I've formally been engaged in something where this is the topic. I was asked to talk about my work and my views on today's topic, which is health crisis and human rights. So I think for me to be able to do that, you need to understand where I come from. So I spent my career helping to train teachers to teach health. My mantra to my students was help kids develop the skills to live a healthy lifestyle. And if we can do that, we can change society. If our kids grow up to be healthier individuals and they know how to help others be healthier, we will be able to change the way we function. I've also been involved in work focused on setting and implementing policies that emphasize that healthier kids learn better. So from the minute I entered my teaching career to the point where I left the state of Indiana, I was really focused on developing those policies, particularly in the area of obesity prevention, which we thought was a crisis at one point. Now we know what a real crisis is now that we're living in this pandemic period. I now get to focus my work on creating a learning environment that helps our students achieve their goals and have high quality learning experiences while addressing community needs, such as workforce development in critical health and human service areas. All of our ultimate goals is to create a healthier community. I'm grounded in training as a health education specialist, and I've spent much of my career working on what we thought was that health crisis, like I mentioned, obesity prevention. Much of what we know from that work can be applied to our work to address the current health crisis, which the understanding that the consequences have been exacerbated in ways that we could never have imagined. So I pull on that background and learning to share my thoughts today. I appreciated what Ivonne said about our social determinants being social influencers rather than calling them determinants, because they are changeable. That is the framework that I'm grounded in. A lot of my work is grounded in that social determinants of health framework. And I think it's critical for us to keep that at the forefront, whether we call them influencers, determinants, and however we refer to that. But that is really something that we have to keep at the forefront. Obviously, all three of us have commented on it without collaborating on this, so we know that this is critical. But the social determinants of health, for those who are unfamiliar, are the conditions and the environments in which people are born, live, learn, work, play, worship, and age, and that affect our health, our quality of life outcomes, and risks that we are all affected by. It might be our neighborhoods and our built environments, the economic stability like housing insecurity or poverty or food insecurity. It might be our education, the early childhood exposure and experiences our young people get, or whether our students are graduating from high school. And then our social and community context, which I've come to greatly appreciate by my new association with our social work department and our civic participation and the addressing of those social cohesion issues. And then finally, health and healthcare. Access to healthcare is critical. And then one of the other areas that I think is really critical to that social determinant is health literacy, and something I believe very strongly in, making sure that everybody is health literate, or our materials and experiences that we share allow people to access that literacy level that they're at. COVID has illuminated our serious deficits in relation to these social determinants, specifically in terms of our food insecurity and access to healthcare. One of the areas that I've really noticed is through our educational inequities. And I love that Veva is a school board member, as a health person. That just really touches my heart, because if we, as my work has been focused on creating schools that are healthy, because we know kids learn better, when you get a school board member that has that bent, it really changes the way we look at things. So I was doing my preparation for this, and I think about, where do we see this impact the most? And I think about reading. And what we know, research has told us that learning to read is likely to be the best predictor of future educational achievements and life success. Much of our research points to third grade. Imagine being a third grader right now, trying to learn how to read in this context, in this situation. Imagine that your parents aren't English language as their first language, and you're trying to learn to read English. Imagine that you don't have, as we talked about the digital literacy, that we don't have access to good internet connections to be able to learn Zoom, or learn to read through this environment. So I don't know the answer, but I'm afraid for us going forward, and it's something that I think we have to keep at the forefront, is what might that learning to read experience look like right now for our families, and what is the impact long-term on our young people not getting the exposure and experiences they need? I know when I was a little girl learning to read, we had small groups, we were pulled out, we got that personal direction, and I'm afraid that our kids are not getting that. I'm a mom of 3 boys. One of mine is a 10th grader right now and in geometry, learning it through Zoom. It's not a good experience. I can tell you that his math skills are decreasing as we speak. So what I know is that the literacy skills are doing that as well. This is a young man who has 2 educated parents who are able to support him and help him. And so I raised this issue for us to think about what is the long-term impact of this crisis on our young learners, and then in time on society. The health literacy of our community is significantly impacted for a long time as a result of this. And Veva, when we spoke about things, she talked about the second or perhaps third wave of inequity that's going to occur. And I really believe that by young people not learning to read in the time that they're supposed to, or at the stages when it was intended, that there will be long-term impacts that that we're unsure how to address and will be suffering from for a long time. Another area that's near and dear to my heart that I think I've seen challenged, well, we've all seen challenged, is the mental health across our society. And again, I go back to my training as a middle school teacher and what I saw with my kids when I was teaching school. And I can't even imagine what the impact is for our young people now. I see it in my home, I see it in my colleagues, I see it in our students at Fresno State. But the difference for a 7-year-old or a 10-year-old is different. And I fear for what the long-term impact is. What we know is that when we can identify mental health challenges in young people in the school ages, they're likely to get the help that they need and get that treated in a more timely fashion. And so I fear for that, what the long-term impact is. Schools are an incredibly important part of the equation as we work to address the health impacts of COVID on our communities. And so I encourage us all to make that part of our conversation on a daily basis about what are we doing to help schools address this. The last thing I want to address is the impact on the workforce that we're seeing. And what are we doing about that, and how are we addressing that? I see it in our students that have had an altered experience. They're not able to go out and have their internships. They're providing care through telehealth. They're missing some of those one-on-one experiences that they might have had in their training, but because of this, that they're providing it in other ways. And I would say perhaps it's that bedside manner that many of our students are missing the opportunity to integrate into their care. The long-term impact is not just on them, but also on the employers. And I'm concerned for that. And I want us to think about how we address that. Our employers, our healthcare organizations, work very hard to onboard new employees. They're now onboarding a new kind of new employee that maybe didn't have the same level of training and experiences that they intended. And so we're all going to have to come together to address this. So I have to go to, what do we do? I don't have big answers. I love the offerings that our other panelists have shared. I went to some of the recommendations of the CDC. That's one of the places that I go to. And things that we need to do. We need to use data and the best available science to inform policies, programs, and resources. We need to prevent whenever possible rather than intervening after the fact. And when we can't prevent, we need to intervene at the very earliest moment we can. We need to consider the whole person and the system structural approach to impacting individual behavior. We need to use our existing partnerships and alliances to reach a broad and diverse audience. We need to champion equity by addressing systematic issues and making it a systems change, not a people change or an individual change. And then we have to recognize the inherent in every community is the wisdom to solve our own problems. We know so much. And it goes back to what my 2 previous panelists said, is that we really need to mobilize our community health worker efforts in our communities to help make that direct impact, to help folks access care and have access to those trusted members of their local community to help them solve these problems within their hubs and their neighborhoods.
Dr. Seabert, thank you so much. We are at time with our speakers, and we did want to allow an opportunity for some interaction. So I want to remind our audience that if you have questions, to please place them in the chat and we will get to them. What I really appreciated, and I just want to thank Dr. Seabert for her remarks about the importance of education, about us addressing what we're seeing in terms of learning loss, because those issues will impact us in the long term. We are going to struggle to get our kids back to the place that they need to be at. And if we fail in that, we will be struggling as communities and as societies in order to be resilient enough to withstand the next challenge that we're facing. So I want to sort of start there in engaging the three of you. I think, you know, what's been clear in each of your comments is the recognition that in our region, we suffered from very long-standing inequities, and that those inequities, whether it was lack of healthy food access or lack of safe places to play, did play a role in developing the amount of pre-existing conditions that we had here. The inequities of not having affordable housing is playing a role in people not being able to be safe and housed. And I think, you know, as I mentioned, we are going to be seeing exacerbation of further inequities. Dr. Vohra, your to-do list got a lot of attention in the chat. And when I look at your to-do list about stay home, it takes me back to the question about housing, right? Like, what can we really do collectively in the partnerships to make sure that we have that affordable housing? When I think about staying safe, I think about, you know, what we're living through in terms of the social injustices that are happening to certain people, right, in our communities. I think the stress affects us and our ability to be kind. We touched upon the ability to be vigilant, given that we live in a region that unfortunately has a huge digital divide and not everybody has access to internet, right? So these are all sort of the reality of the human rights, right? Like what we want to get to addressing. How do we get back to focusing on that so that we can emerge from this better, building better back. So I just wanted to open it up. You all have given some suggestions, but I think when we boil down to sort of these things, staying home, staying safe, staying kind, where do we go? What type of partnerships, what type of workforce development, what do we need to get out of it?
Well, you know, I'll go first. I think that definitely requires a group answer and lots of creativity. But yeah, you know, I think the secret is just thinking outside of the box. I think, you know, no disaster is the same, because if we were prepared for it, it wouldn't be a disaster, you know, and that's exactly what's been played out this whole year. Is we just weren't prepared for this disaster, and it really exploited all of the holes that we have in our society, unfortunately. Holes related to housing and the social determinants of health that we just discussed, and really our politicization of science, which it didn't start in 2020. I mean, it's been brewing for a while. And we just need to confront those, because, you know, the next disaster is going to keep exploiting those same vulnerabilities unless we take care of them. So on the one hand, obviously, there's a lot of tragedy and pain related to any crisis and disaster. On the other, there's room for growth and an opportunity for us to learn to say, let's not make these same mistakes again. The homelessness is a great example. As you know, Viva, we have created stakeholders and partnerships related to housing the homeless, which has been an intractable problem. And talk to any of the people involved, and they'll tell you we did more in the first 6 months of this year than people have done in the last 10 years related to homelessness, because everybody just rolled up their sleeves and decided to work together and set aside differences and just say, let's solve this problem, because otherwise it's really going to create a crisis within this larger crisis of the viral infection. So that really allowed us to, you know, find alternative housing, find a way to connect everyone through telemedicine, find ways that agencies could reach across their borders so that they could provide support. That's exactly what we need to do with all of these problems, is really figure out new and creative ways that people can work together.
Thank you. Ivonne and Dr. Seabert?
Dr. Vohra, you hit one of the topics that I was going to talk about, which was the homelessness. It was really amazing to me, right when this pandemic started, how quickly we were able to house many of the homeless. Granted, it was temporary housing, it wasn't permanent housing, but we were able to reach out and work with them, work with the homeless to get them into a safe place so that we could triage them into different services. So that was one of the things. The other thing that we, in terms of working together, hospitals have really worked together to make sure that we are treating as many patients in the right setting. We're working with our SNFs, we're working with our clinics to make sure that we're connecting people so that our hospitals are not directly impacted in the emergency department because there's no room. And so that element of coming together to solving a problem, a challenge, really, that was something that was also highlighted here. It wasn't just the inequities, but it was also our ability to come together and work and solve something that was much greater than one organization could handle. And so if we continue that collaborative spirit beyond this, I think there are so many other challenges that we will be able to solve together and really put our heads together and get some creative ideas there.
I would say the last thing I would bring into this is, I'm really going back to my introduction, and that I said I spent my career training teachers to help teach kids to live a healthier lifestyle. I think health literacy is something that needs to be at the core of every effort that we have in our community, because it's through health literacy that we get access to care, that we know what resources that our insurance provides us, that we know where to go when things are happening, or others who are health literate can help us access that. And so I'm gonna put in the plug that I think we really need to help create a health literate community that then helps us access the next level and be able to solve things through, by putting in policy and other practices in place.
Here's the other thing, Beva. When this pandemic started, we talked about isolation, making sure that we were isolated, that we isolated from different people in our families. And I think we need to be bold enough and brave enough to speak up, because right from the get-go, one of the things that was very clear to me, and I hope it was clear to so many of you, was that isolating was a luxury that not everybody had. We have households who have multi-family households. Some families live in one room. And so to tell a person, isolate in a different room away from your family, was not realistic. And so that meant that we needed to elevate the notion of wear a mask at home if you can't isolate from everybody else, because that truly was a luxury that not everybody had. And so we need to be able to speak up when we know those truths and help others understand why it was so difficult for some people to isolate or stay home from work. It wasn't realistic for all families.
That's right. Thank you. Really key points. On this panel, what is important to recognize is that we have public health, healthcare, and education together. But the wonderful participants who helped to make this event possible also represent faith-based communities. And we have a multitude of other sectors that I'm sure are listening in and joining. And I think each one of them is asking, like, what can I do? What is something that I can do in partnership that could really help us right now? And I'm just wondering, from each of your positions where you sit, Are there particular partnerships, reorganizing, some way of working together that you think would be really effective and important to do right now?
I will start that if that's okay.
Go ahead, go ahead.
I think how do we partner? We have to look at all the sectors. Healthcare partners with public health and education and community-based organizations. And what we need to do is take a look at who's already in the neighborhood, in the community, who already has the trust of the people living within those communities, and help support, whether that's financial, whether that's with information, whether that's with volunteers, help support the organizations that are already in our neighborhoods, because they've already been doing phenomenal work. And so let's not reinvent, let's help move it forward.
Dr. Vohra, Dr. Seabert, would you like to mention or suggest any other actions?
Well, you know, we've been partnering. We consider our faith communities just essential stakeholders and really credible messengers into so many different populations. This is the most diverse town I've ever lived in, and I've lived in, you know, large cities. And as Paul knows, we speak 100 different languages. We have hundreds of countries and cultures represented. And our faith communities are really the one common thing that binds almost every family in the Valley, is that we're all very strong in our faiths. So we recognized very early that we needed to really work with and partner with our faith organizations to not only do messaging, but, you know, we rely on them to help us get testing, to help us do flu vaccinations. We're going to be knocking on their door as soon as these vaccines get into town to say, look, how can we partner together to vaccinate your congregations? And there's 100 other ways that we can be creative. And they're telling us how they can keep folks safe in ways that we haven't thought of yet. So it's really just a dialogue that we've had on a weekly basis. We have a weekly call with our faith-based organizations. But that's the kind of like very deep and rich dialogue that I think leads to really productive solutions. And it's been a really, you know, it's not the kind of thing that they teach you in medical school or in emergency medicine residency. So this has been a real learning curve for me, just how public health really has to engage with all of these different sectors and have these conversations.
Yeah, thank you.
And I would just reinforce what they've said.
Okay.
We'll get another question in.
Yeah, let's get another question in. And I'm looking in the chat feature. There is, you know, a really good question that takes back to some of the points that a few of you mentioned. The question is from Daily Dunn, and it says, what are some of the ways we can try to make change to the systemic racism in healthcare? And bringing that into education, she also mentions, what are some of the ways we can fix the school to prison pipeline? So we had, you know, some talking points about the fact that we are in a provider shortage area, Ivonne, and that our providers don't always reflect the community that they're serving, right?
Yeah,
so,
and that's been true for a long time. And so, you know, really raise the voice for making sure that we're encouraging our students to follow a pathway into healthcare. But for the providers that are already in healthcare and are not reflective of the community that they're serving, I think there's a lot of awareness that has to happen internally. And that's what we've been doing, is we've been providing some ways for our providers to understand what the differences are and why it's important. I keep raising our hand to say, is that information available in different languages? Make sure that we're not English only. Make sure that we understand the belief system of our indigenous groups, because they see medicine in a different way. And so it's just really being brave, again, being brave and always speaking up for the communities that we're serving, encouraging our students to follow a pathway that is not traditional. We, have seen the shortage in our labs for clinical, in our laboratories, respiratory therapists. Right now, that is what we've seen, the shortage of providers that stay in our community, that get to learn in our community. And that's why it's important to expand on our residency programs and get residents who are from this community. And so I keep raising that voice again. And I think all of our hospitals are attempting to do the same thing, is get residents who reflect our community, who are from our community, who will stay here and work with our families.
I know that is the right approach. And I also know that's the long-term approach, right? Being able to cultivate those providers over the long term doesn't immediately resolve the issues that we're facing now. So Dr. Seabert, how can we train and build the capacity, consciousness, cultural humility with our existing healthcare providers to sort of address this issue that Daily Lung is bringing up?
Well, I went back to the community health worker. I think I'm a big believer that we all need people to advocate for us. And sometimes that person is right with us. Sometimes they're cheering us from behind. And I think sometimes they go to those appointments with us and they help us access that care at a deeper level. And so I know there's numerous conversations. In just my few months here, I have identified that this community health worker movement is really strong in this community, and that people are being trained, that they are trying to seek grants to put community health workers directly in our communities to help folks better access that care. And I think that's the immediate answer, is that people who are from each of these communities, that are from our faith-based organizations that are right there alongside us, going to help us get the best care we can and be our advocate, our health navigator, our health advocate that we need when we can't do that for ourselves. We have started a partnership, for example, down in Visalia to train RN to BSNs through the community college down there, College of Sequoias, to help keep people in the region there. And I think we have to start developing more and more of those partnerships to train our healthcare workers to work where they live. And I think that is also something that communities have to embrace and make that a mantra of the community, is that we want people who work where they live.
I'm going to take another question. And certainly, Dr. Vohra, just to riff off of what Dr. Seabert said, I know that you guys are putting that into practice, right? That there are phenomenal partnerships that I'm lucky to be involved with as well in the COVID Equity Project, where we are engaging community health workers, promotoras, to address COVID. And that we need that language and cultural diversity, and that oftentimes those same lay people are not the people who have the digital literacy, who are not necessarily having the right capacity to engage with our existing systems. It doesn't mean we shouldn't stop trying, right? That is the right approach. But I'm thinking about, the need about contact tracing, about the upcoming need for vaccinations, right? And how we do need those trusted connections in our community. One of the questions in our chat is, should the vaccinations, should they be mandatory?
Yeah, great question. So on your first point, I think one of the really wise insights about doing any work at a population level is you have to meet people where they are. And you really have to just lean into what their needs are and what their comfort level is with making a positive change. Some people want to make, a dramatic positive change, and we should certainly encourage that. Other people may not be ready to take that step, and we should be fine with that too, and work with them where they are to really nudge them in the right direction of hopefully a healthier lifestyle. And that's just a general rule. That's definitely what we try to do. I know with the pandemic, there's been a lot of, I think, somewhat heavy-handed declarations that come from the state usually that we have to enforce. And that's unfortunately, that's just where we are because there's such an emergency going on with all of the cases that we're seeing. But in general, in a normal year and in a normal situation, public health is really all about meeting people where they are and really engaging with the community-based organizations so that we can really speak people's language, understand their culture, be sensitive to context, just surrounding making really hard decisions about people's lives, especially whenever they are trying to understand a disease that's very foreign, or even a medication like a vaccine that's very foreign. I think we're all there with the vaccine because it's so new. I think all of us are trying to incorporate the science as quickly as we can. Some of us have medical training and some of us don't. What I can tell you is that the vaccine won't be mandatory. It will be something that is, I would say, recommended and even highly recommended for some of our higher risk groups. So who's considered a high risk group? Well, someone that has a high chance of catching it, someone that has a high chance of passing it on, and someone that has a high chance of dying from it. So I would say that, if you're in the front lines of healthcare like I am as an emergency physician, or as our hospital workers are, regardless of if they're doctors, nurses, respiratory therapists, they work in the janitorial department, those are all folks that we want to protect. We consider them high risk and high priority. And that's really how the vaccination schedule has been made so far, is to make sure that we're really protecting the people that are at the highest risk. And obviously, our frail elderly population in the nursing homes, in other congregate living situations are also towards the top of that list for the very same reason. But for none of these people is the vaccine going to be mandatory. We want people to be educated. We want people to ask hard questions. We want people to really understand the safety and design of these vaccines. And remember, vaccines have been around for like 100 years. So it's not like, the analogy that I gave to someone yesterday was, when you take your car to a shop and the mechanic fixes it in 45 minutes, you shouldn't say, oh my gosh, that was too short. You really didn't study my car. You should really say, wow, you've been a mechanic for 20 years and you knew exactly what the problem was. And that's why I got my car out of there in 45 minutes. That's exactly what vaccine scientists are. They've been doing vaccine research for decades. And that's why they've been able to come up with this vaccine so quickly, is because they've brought all of those tools and all of that training and technology in and just got to work on this specific problem very quickly. So I know that there's some hesitation just because the vaccine seems to be rushed or developed too quickly, but it's only because we had decades and decades of expertise that were brought to bear to develop this vaccine. So I'm definitely going to be first in line when it's my time. I'm very excited about the news and the research that's coming out. And as soon as the FDA gives its stamp of approval, remember the state of California is going to have its own independent scientific committee. And they also have a separate committee that's all about engaging the community and making sure that the communities that are most vulnerable have representation about how the vaccine allocation is done. So the state of California is going above and beyond what the FDA is saying to really make sure that our most vulnerable populations really get this vaccine and that it's been very well vetted and it's a very transparent process.
Thank you for that, Dr. Vohra, very reassuring.
Sure.
I want to be conscious of our time. We have a few precious minutes left, and I want to just cue the panelists that I'll be asking for your closing remarks. I do want to try to get to just one more question, and being that I am an advocate of good community health and prevention, I do want to get us to think about how we get back to addressing, again, those pre-existing health inequities that existed. Dr. Seabert, you talked about the importance of nutrition and wellness, right? And really trying to create healthy communities through policies and systems changes in order so that people can lead healthy lives. And that certainly has been the history of a lot of the work that we've been doing. And I'm looking forward to having an offline conversation much deeper with you about that. But, you know, a lot of the things that it requires are shaping policies, right? And becoming civically engaged and having those relationships with our decision makers. everything that we talked about tonight, our provider shortage, building educational institutions, right? All of these things really do center on policies and system change issues. And how do we become those better agents that you were speaking to, Dr. Seabert? Like how can we engage better as community members and partners into making sure that our needs are identified and that we're speaking to those key decision makers who have the power to help us make that change?
You ask tough questions. That's a very appropriate and thoughtful question. I appreciate that. I think, you know, it goes back to the things that in my heart, what we've been saying. It takes a village. It takes all of us coming together and using our best skills to be at the table. So I need to be at the table or where I can be, and you need to be where you can be. And all of those who are in the room with us tonight need to be at the table where their skills can best be used. And I think that that's how we start making change, is that we all step up and say, yes, I am committed to making a difference and to helping. And, you know, one of the things that I've realized is that I need to make sure that I'm asking those questions every time policy conversations are up. Are we making sure that inequity is being talked about? Are we being sure that access to care is being talked about? And just, we all need to take responsibility and move forward on that in the places and spaces we can. Not a strong answer, but it is what at my heart, it is the truth, and it's the real thing that we can do.
I think it's the totally dead on answer, you know, and I'll say as an elected official myself, I don't know everything. And I need the voices of people who are suffering injustice or inequity or some hardship to help elevate that, so that I can figure out what is within my power to change. And I'm sure that many of my colleagues in decision-making seats would feel the same. And you're right, those folks like yourself and other leaders such as Dr. Vohra and Ivonne and Dr. Kapoor, helping to raise those issues is part of what needs to happen in order to gain the attention and really come up with the solutions that we need. So it's been a wonderful conversation so far, and I really wish we could continue, but we are running out of time. And so I just wanted to ask if there are closing remarks, if you would like to make a few minutes to each one of you for some closing remarks. So let's start with Ivonne.
Bev, I just want to say thank you for leading the conversation. I want to thank my fellow panelists. This is a really good conversation around health and how we address the inequities. Dr. Kapoor, thank you for your leadership, and to the planning committee for planning this event. I think, and I hope it was very well received.
Dr. Vohra, Dr. Seabert?
I will say it was an honor and privilege to get to share time talking about such a critical issue. I'm a believer of grassroots social impact, you know, collective impact type work. And I think that this is our chance to really like get to the, you know, that grass and really get our roots deepened in our community and make change. And I guess my challenge to everybody is do what you can where you can and stay safe.
Great. And I couldn't agree more. I think that those are great words of wisdom. Thank you all, and thank you to my fellow panelists and to Dr. Kapoor for organizing this. I hope it won't be another 75 years before we do another similar event, because this was just so fruitful and constructive for us to just all gather together and talk about these very important, some short-term and some very long-term topics. So I look forward to doing this again, and I hope everyone can remember to stay safe and have a warm and wonderful holiday season, despite all of the challenges and hardships that we're currently enduring. Thank you.
And thank you, and thank you to our other panelists. Really fantastic conversation. Before we sign off, I do want to make some closing remarks. the health educator in me isn't going to let you go without doing one final reminder to ask you to please wear your masks. To the Latinos who may be listening, we're in tamale season, and it's much better to spread masa than to spread COVID. We're getting into Christmas season, and I would recommend that we all continue to spread cheer and not COVID. Wear your masks, please. Please continue to physically distance. It doesn't mean that you can't be engaged with those that you love. Just try to create that distance that is protective for you and for your family. I would also say that stay at home, right? All of those wonderful to-dos that Dr. Vohra gave, I would just reinforce to all of you. And I do think it's important for us to continue to respond to this pandemic as best we can. But I don't want us to forget all of those other very important issues that we do need to get back to addressing, right? The inequities, whether it's access to healthy food or advocating for parks, all of those things keep us healthy. We definitely have a lot to do in education as well. So in closing, I just want to make some final thank yous to partners. I want to thank Ashley, who has been listing our partners and their websites in the chat. But thanks to the Human Rights Coalition, Fresno State Ethics Center, the Islamic Cultural Center of Fresno, WILF, Women's International League for Peace and Freedom, the Central Valley Partnership, the Universal Unitarian Church of Fresno, the Roman Catholic Diocese of Fresno, Interfaith Alliance of Central California, St. Agnes Medical Center, Fresno Center for Nonviolence, Peace Fresno, Democratic Women in Action, BWAPA, the Black Women Organized for Political Action, We Are Not Invisible, Fresno Building Healthy Communities, Community United Church of Christ, California Faculty Association, the Fresno State Chapter, and the Interfaith Scholar Weekend. Thank you so much for your partnership in bringing this day and this event together. I'm very grateful. With that, I wanted to turn it back to Dr. Kapoor, who I'm sure would like to make some closing remarks.
Well, thank you very much. It was a really wonderful presentation, interaction. We are really very thankful to the panelists, to Dr. Vohra, Dr. Seabert, and Ivonne. And our special thanks to you, Veva, for moderating the panel in a very skillful, in a very professional manner. We are very proud of your being a part of Fresno State. You are a product of Fresno State. We are very proud of that our students are doing such a wonderful job providing leadership in the community. And we are really thankful to you for that. I also want to actually ask if the panelists, as Dr. Vohra mentioned, we may actually have something follow up after this one. So we may reach you out again because there's community health education, health literacy, all these issues that have come up. And all of us believe that healthcare is a human right. And we want to really proceed about that. We may be reaching you again. And I also want to thank my committee. This committee has been working for many, many weeks and days. And so I really want to express my deep thanks. Actually, all of them I see them on the screen also here. I wish to express my deep thanks for their cooperation, their diligence, their hard work, and their commitment actually to promote human rights, and which is our primary goal here is. And I say that there is a human right dimension of everything that we do. We sometimes don't realize that over there. So there is some kind of dimension attached to everything that we do. And we really want to bring this kind of awareness in the community. We at present do social advocacy, but not the legal advocacy like that over there. Once again, thank you very much for your participation, your input, your wisdom, sharing all what you shared with us. We really, my students actually, I'm pretty sure, are going to give me a reaction paper. It is a required reaction paper to all the students. I have about 30 of them in my class who are listening. Some of them have some conflict. We are going to make this available, recording statement to all of them. Once again, thank you very much from the deep bottom of our heart for all of your participation. Thank you. God bless you. Peace upon you all the time.
Thank you. Have a great evening.
Thank you. Good evening.